Welcome to another episode of Your Faith and Health Community. I'm your host, Pastor Jackie Jackson, and as always, we want to thank you for taking out time from your day to spend with us. You could have been doing anything else with your day, and we really appreciate you taking time out to sit, listen, let's talk, let's get some information. Now, before we get to the guest, I'm going to mention it again. You know what? No, in fact, for a change, I'm not going to mention it. Since we have two navigators here from Resolute out of Dayton, Ohio, instead of me giving you my usual spiel, let's bring them in and talk. So you've already met them if you watched the first half. If not, let me introduce again. We have Marjorie Mosley, who is a navigator, and we have Ryan Fay, who is also a navigator from the organization Resolute out of Dayton, Ohio. It is a navigating organization, or they do navigation, which is, those are the people who will help you get enrolled in healthcare, whether Marketplace or Medicaid. Now, let's talk about this. What is Resolute exactly, and what do you do other than navigation?
Resolute is a company that has comes out of the state of Missouri. They've been in existence for 16 years, and they applied for one of the grants that goes out into the community that assists people with information about the Affordable Health Care Act and applying for health insurance via the Health Act, the ACA.
Yeah, and we have been doing this out of Dayton now for, I believe, 3 years that we've had the grant now successively, pardon me. It's grown over time. Originally, I think it was just 7 or 8 counties, most of which were in Dayton, Ohio, and just a little bit north of Dayton. But I believe 2 years ago, it was expanded to include the great city of Cincinnati. So, and not just Cincinnati, we also have all of Hamilton County, all of Butler County, Warren County, Claremont County, and as I said, a lot of the counties up north along 75 on both sides. So you've got all the suburbs of Dayton and some of the rural northern counties as well. So got a big impact in southern and western Ohio. We can help anyone in the state of Ohio though. So if you're watching and you have family members that are just a little bit outside of one of those counties, but they're still a resident of Ohio, be happy to help them too. So.
Okay. And so you also you train other organizations, or do you train volunteers, or?
We don't have volunteers. What we do have is we have an education component to our grant. And so we go out and we do presentations, tabling, like what we used to do in Enroll America. And we talk to them about healthcare. People have questions regarding themselves or their family members. We talk about what is available for them and their family, their healthcare needs.
Mm-hmm. So we do some of the public education, like Marjorie just touched on, tabling events at public health fairs, community fairs, things like that. But in terms of training, like you just said, we do a little of that too. The last one I believe Marjorie and I did together was we met with a women's shelter in Springfield, and they had a large staff that deals with women's issues, and particularly women that have been victims of domestic violence. And they're people that especially if they're covered under a family plan, if they're in some kind of issue with their family and spouse, they need to find other means to get covered. So part of our job is to go there and help their staff understand the implications of that, not just for the women themselves, but how we can help those women and their families pick up new health insurance if their old if their old insurance was discontinued. So that's just one example of another organization that we go to, and because not every organization is extremely familiar with the ACA and with its provisions and how it can help the populations they serve specifically. So we do a lot of outreach, not just to individuals and families, but to the organizations, and kind of make sure they're up to speed. Typically, we don't train them to go as far to do what we do themselves. We're not going to go in there and say, hey, by the end of today, you'll be able to do exactly what we do. We go in there and teach them about what we do and why we do it.
Have a conversation around it.
Exactly. And then hopefully at that point, they trust us enough to where they will refer their individuals to us. We're listed as an official resource for assistance on healthcare.gov, and a lot of people do find us on their own, But the vast majority of the individuals and families that we help through the navigation process are referred to us by other community organizations that we've reached out and created a relationship with.
Or word of mouth.
Word of mouth.
Yes.
So we've helped someone, and we can get a call, and that person will say, you helped my cousin or my neighbor or my friend, and they gave me the number, and that's why we're calling you today.
Okay, so do you also go out to any faith-based organizations and
Yes,
do
we
training?
do. We connect with coalitions of faith-based organizations and collaborate with them about the work that we're doing out in the community. We tell them what's going on, what changes are happening in the community with regards to the ACA, so that they can better share with folks that they have contact with, because there's just no way one person can make it to all of the different groups that exist. So that's why we have the collaborations and the partnerships that exist in the communities.
Right, and it's not even, we try very extensively to work with the faith-based community, all different faiths, interfaith. We reach out to, like I said, women's shelters, things like that. We reach out to libraries, to try and say, hey, do you have a regular clientele that comes and utilizes your facility? Can we put up our flyers here? We work with schools, both public schools and even universities. One of our biggest collaborations is with Central State University up in Wilberforce. They've been a great partner for us to make sure their students can get enrolled and stay healthy while they're there at school. Some of the other ones we work with are public clinics, specifically in Dayton. We have a great relationship with the Good Neighbor House Clinic there. So we try to reach out and throw as many lines in the water as we can, because we know the more people we can reach, there are a lot of people out there that can utilize our services, and we just got to reach them. And even sitting down talking with you today, another way that we try to reach out, make ourselves known, because everything we do is free, by the way. I don't think that's even something we've mentioned yet.
Right,
actually.
right.
Don't you mean I can leave my wallet at home?
Yes.
The grant pays for everything. We're on a federal grant. There is no charge for our services or anything like that. We're just about making sure that people can get help they need enrolling in healthcare.
Well, let's do
Informed
this.
people,
Oh, go ahead.
Jackie, are empowered people. So the more people that are informed, the more they're empowered, and then they will begin to develop those relationships with the doctors and the clinics or wherever they choose to find healthcare service in their communities. So it's about empowering and educating so people can access affordable, better healthcare for themselves and their families.
And you're right, power. Even the scripture says, my people perish for lack of information. And information is power. And when you have some information, you can move forward. You can progress. So let's do this real quick, and we'll do it again at the end. And I know that the producer, Anita Alexander, she's going to put the information up. But real quick, just tell everybody how they can reach you, in case they have to leave before the show's over with.
Right, so there's a couple different ways you can reach us. Best way is just give our office a call. Like you guys mentioned that we're based in Dayton, but we're down here in Cincinnati all the time. We're over in Claremont, Warren, Butler, a lot of other counties. So you can always just give us a call at 937-222-7270.
Say it one more time.
Yeah, of course.
And take it slow.
937-222-7270. That'll go straight to our office, and you just ask for a navigator.
Okay. And can they send an email? Is there a website to go to, or is that just the best thing to do?
Yeah, our website is down for maintenance right now, but if you go to helpmeenroll.org, that'll take you straight to our website here. We're also present in Nebraska, but you just click on the Ohio section. That'll bring you right to Marjorie, myself, and the other two coworkers we have up there. My personal email is rfay@weareresolute.com. Marjorie's is mmosley, MOSELEY, @weareresolute.com. You can shoot us an email or give us a call anytime. We'll be happy to make a time to meet with you and sit down and see what we need to do for you.
Okay, look, and if you missed that, if you didn't get to your pen in time, or weren't able to get it written down, we're going to do it again at the end of the show. And as I mentioned, I know that Anita will have it up, so you'll be able to get it, make your phone call, and get some help. And I know we're kind of bouncing around on some stuff, but I want to go back. What we started, I think you started toward the end of the first half, and it was talking about the plans, the silver, the bronze, was it bronze, silver, gold, platinum. So can we talk about those plans? Because
Definitely.
other than color, for some people it just sounds like, what is this, the Wizard of Oz?
Right?
So let's talk about that.
Definitely. So I'll give it a start. And basically, the way that you distinguish between those is it's what's called cost sharing. So most of us have heard things like copays, deductibles, things like that. It's the amount that you're supposed to contribute towards your health care as well. And then the insurance plan will make up the difference, especially if you're, using medical care that can add up in cost over time. So I'll give you an example. On a bronze plan, you're going to have a way higher deductible. It could be, even for a lot of plans, it can be up in the thousands of dollars. As you get up into the silver and the gold, it's going to come way down. And that deductible is the amount that you're going to pay for your medical care before the plan starts kicking in for most of your expenses. So that's why we mentioned last week's show, if you're younger and you're not using so many health services, you can get away with a higher deductible plan, because if you're not even going to ever hit it, you might as well pay less per month in premiums to get it. But if you're someone that is using a lot of ongoing health services and you're going to hit your deductible really quickly, you can pay a little more per month, but then it's going to save you over the course of that year, because the insurance part of it is going to kick in way quicker, and it's going to save you on a lot of those out-of-pocket costs. You're going to have lower copays. Sometimes the higher-end plans, you can see and utilize some of your medical services without any copays. A lot of them cover generic prescriptions at no cost. You can see your primary care physician at no cost. You can see a specialist at a way lower cost than you might expect. Now, the different insurance companies themselves structure their plans differently. It's not like one plan's gold is going to be identical to another plan's gold. So that's just another reason to even come down and sit with us, is we can really easily help you compare the differences in these and say, well, is this going to save me money over the course of the year, or am I going to be paying a little more but not necessarily getting any benefits from it?
And what I pay for a plan, whether it's gold, silver, platinum, is relative to my income, right? So it's not across the board that all three of us here, we all three get platinum and we're all going to pay the same amount.
Right, that's going to be based very much on income. Now, the plans themselves do all cost the same on paper. So, say you buy X health insurance plan's silver plan. That plan does have a certain set cost to it. Let's say it's $500 a month. But then what healthcare.gov is going to do is it's going to look at each of us, our individual income. And, let's say I have the lowest income, Jackie, you're middle, Marjorie, you're highest. I'm going to pay the least for it, and they're going to take that into account, and they're going to subsidize it. So even though it costs $500 a month, I may only end up paying $50 or $100. You might end up paying $200, $250, and Marjorie, if you've got a lot of money coming in, you might be paying full price, but
That's Marjorie, a lot of money.
Right? She loves it, but 80% of Ohioans do get some help paying for it. So it doesn't matter if you're just a little bit over the Medicaid line or if you're not even close to being Medicaid eligible. 80%, pretty good odds you're going to get some kind of help paying for it, but it totally depends on and is relative to your income.
So then let me ask, so let's take both ends, excuse me, of the spectrum. So the bronze versus the platinum. I'm just jumping from one end to the other.
Right.
How different, and I know you said that, based on the plan, it's going to determine your deductible. But what do I lose by going with the bronze versus the platinum, other than my deductible being lower? So are there certain services that I won't be able to get because I went with the bronze versus the platinum? Or we can go to the middle, silver versus gold. There's a silver, right? What do I lose within those two plans?
In terms of the actual medical services, throw the financial part of it out for a second. In terms of actual medical and healthcare, there's no difference. They're going to cover the same essential health benefits. That's what the ACA calls them. Prescription coverage, primary care doctor, ER care, things like that. It's not like if you get a bronze, it's going to not cover those kinds of certain things. Now, the real difference is in the financial part.
Out-of-pocket costs.
Out-of-pocket costs. Yeah, the bronze the bronze and the gold are both going to cover, say an ER visit, but one of them you're going to pay a lot more at the point of using it than the other. That's the only difference, but it's not like you're going to, I have a bronze, so I can't get my insulin covered or something like that. It's not the case. It's just going to be a matter of how much you pay out of pocket versus how much you pay per month. So that's why it comes down to, what are your medical needs? If you are using a lot of medical care, yeah, you're going to pay a little more every month in your premiums, but it's going to save you a lot over the course of the year when you hit your deductible real quick and the insurance company picks up the tab.
Which is also good because when you're looking at, for instance, myself with with having a heart attack in the past, with having a little small stroke in the past, so that means that for me medical, now to God be the glory, it hasn't been an issue in my life in a couple of years, but I know it could come back. But there's no need for me to financially destroy myself saying I'm going to go with the platinum, other than, like you said, for the reason that it's going to give me less than my deductible. I'll hit that point a lot faster, but I'm not going to lose anything. I'm not going to lose any of the services. So I could actually be smart, financially smart, and say, I can't afford the platinum to sustain it. And what's going to end up happening is maybe I'll go a few months and then I'm going to end up losing it and then not having the health care at all, versus saying, my deductible may be a little bit higher, but if I go gold, I can financially manage maintaining that insurance through the next year better than I can. Or if I go silver, I can maintain it a lot better and at least go with that until I can get to a bigger one. And I'm just saying that to say it's important that you don't have to send yourself into bankruptcy because you're thinking, if I don't get this big one, I won't have prescription and I won't have doctor visits and I won't have preventative care. And you're going to get, what is it, 10 essentials? Or am I thinking vitamins? Is it 10 essentials? I forget what the number was, but I think it was 10 or whatever essential things that it's going to cover no matter what plan, no matter what state you're in.
So the really good thing about this, Jackie, is the fact that you can bring your doctor and say, well, not bring them personally, but the information of who your doctor is. And when we're looking at the plan, we can see if your doctor's under that plan. So that is a benefit. And then it tells you that your doctor's under this plan, he or she will be covered. And you can bring your specialist that you use if you need specialists. And we can look that up. And then we can say, hey, they're all under this plan. This works for you and your family. It meets your family needs. And you can utilize this. And the other thing is, once you select a plan, once you select a provider, you can get that 800 number to that provider and call them and say, I would like you to do this. I don't want a bill. Is it possible for me to have this taken out of my account? What steps do I have to take to give you that information? If I don't know if they can or if they can't, and then you know that right then and there. Because when I first started doing this work, there were people like, Marjorie, I don't want a bill. I said, well, let's call the insurance company and see what they can do. And they were able to set up for that person to get that deducted out of their savings or checking account for them. That is so important for people. Making things simpler for them by just asking. And sometimes it's intimidating. People don't want to, they don't think that it can happen for them. And it actually can, just by asking the questions.
Right. And sorry, real quick, just to build on that, it's important too. Marjorie's absolutely right. Part of working with us, we can easily look up, make sure your doctors that you already like and have a relationship with, they know you, they know your health. We can help make sure that they're in that same plan. Even a step beyond that, we can help make sure that your local ER care is going to be covered in network for that plan. And for a lot of people, this is a huge, huge consideration.
Are there hospitals?
They're hospitals and they're pharmaceuticals. We can make sure that your medicines are covered under that plan's drug formulary, because a lot of people, they might think, I have insurance, it'll cover any medicine. No, it won't, not necessarily. So we got to make sure that, I sat down with a gentleman a couple months ago, unfortunately he's fighting a type of cancer, and he's on, I think, swear to God, about 25 different medications. And so for him, it wasn't just a matter of making sure his doctor was in it. He had to make sure that these very expensive medicines were covered as well. And that factored into which plan he selected, because one of them, it's like, oh, this plan covers 12 of them and my doctor, but this plan covers 20 of them and my doctor. That, to him, was a way bigger consideration of how much does it cost. So there's a ton of things to take into account with that.
Because that medication, but just paying for certain I know I'm trying to remember what it was. It was one of the times back with Enroll when I was going to the hospital as if it was a movie. And one of the medications before I had insurance, they said it, when I took it to the pharmacy, they said something like $500. And I was like, well, you can go and put that one back.
Yeah.
And they said, well, didn't your doctor say you need it? And it's like, okay, are you going to pay for it? So I want to ask, I have two questions I want to make sure I ask. Well, one is a statement, one isn't a question. And that it's very important that when people call to sit down with a navigator, your goal is not to try to just make it super in, super out. Because the more time you take, the more time you sit down, the better chances you are of checking on medication, coming in with your list of medications, your list of doctors. I have a specific hospital I like to go to. And coming in with that so that when they sit down with you, they have all of the questions they need to have to make a very good choice financially and what's going to cover them as far as Medicare, or not Medicare, the program, but their medical care. Mm-hmm. Now my question is, what if after I sit down with you for 3 hours?
I hope not. It's going to be 3 hours.
We've seen it.
We've seen it.
Right?
We hope
Okay.
not. Yeah.
I sit with you for 3 hours. I brought my medicine. We've done all this. I get it. I'm enrolled. I've made my payments, and now I change my mind, and I don't want to be. I don't want to be gold. I want to be platinum. I don't want to be silver. I want to be gold. And it's 6 months in. Or I realize that I financially cannot continue to pay
If your
them.
financial circumstances change, that's why you call the marketplace, because they can go back in and make adjustments. We cannot do
So
that.
I can't call you up and say, hey, Marjorie Ryan, I can't do it. And you
No,
go,
sir.
come back out and spend another 3 hours with me.
No.
Right. Our job is to get you enrolled. There are limits on what we. No, I'm just saying, because I don't want to get their expectations up for things that I want to be real frank about what we can and can't help them with. The marketplace directly will have to help with things like that, but we are more than happy to sit down with you as long as it takes in order to get you actually enrolled into the process. But we do actually get a lot of people that call us for issues like that. And, that's when we just say, hey, look, I'm happy to give you this information, but this is something the marketplace at healthcare.gov themselves has to address with
But
you.
there
So-
are potentially, you're not necessarily just stuck. So you're
No.
saying there are potentially, you're not guaranteed, so they can't call Resolute and say, you said that I could, but you're saying there are some, but that's from a financial standpoint, right?
If the person doesn't feel comfortable, that comes in under the education component of what we do. I will tell you to come in and I will call with you. And the person will give me permission to speak on their behalf at that moment for that day with regards to the questions that they have. Like I said to you before, sometimes this is intimidating for people. And so because we have the skill set that we're able to do it, I am more than welcome for people to call me and say, come on in, I'll meet with you where you're at, and we'll make this call together for you so we can transition you so that you make the right changes regarding your healthcare needs.
Right, and Jackie, you touched on it a couple minutes ago when you talked about, when you're making that initial decision, you don't necessarily have to go for the most expensive thing thinking, oh, well, is that going to keep me covered? One thing that we make absolutely sure that we do is we never try to set someone up with something that we don't think that they can afford down the line. That's one of the first things we ask is, kind of what's your budget for this? Mm-hmm. Don't think about what might happen in this case because you've got your deductibles and copays regardless. Think about what can you afford month to month, because we want to make sure this continuation keeps up, because then, you're not going to be uninsured somewhere down the road. You're not going to owe the penalty for being uninsured for any part of the year. What's the bare, or what's the absolute minimum you're sure you can afford to make sure that this isn't going to lapse? And that's something, and this goes actually really well in line with the fact that we are not salespeople. What we do might kind of look like it because, we're comparing plans. We are, shopping around for plans. That is the term the marketplace uses. But we're not the kind of people that we have zero incentive, period, to upsell on a more expensive plan. Like I said, our job is just to make sure you get the most affordable thing that meets your needs. And if that happens to be a bronze plan or a silver plan instead of a gold or platinum, that's great. We're just glad you're covered.
Right, because you guys aren't getting commission.
No.
You're not pumping out as many. We got to get as many people enrolled as possible because I'm trying to hit that bonus.
Right.
And that really makes it good because you're under no pressure to try to push people to do something that doesn't make sense. And though we've met before, I worked with Marjorie for a few years, and so I've watched her work way past her time of when she should have been gone home and it's dark outside trying to get somebody enrolled. And if you guys are working together, I'd assume you're probably the same way. Mm-hmm. So we're kind of running out of time, and I want to give you both an opportunity. I know we've kind of covered a number of things, maybe not everything you wanted to cover or everything that we should. So what I want to do is if there's something that we haven't touched, we have about 3 minutes. Well, you have about a minute each, and go.
So I'll start real quick. There is one aspect to this entire law in the federal marketplace that we haven't touched on, and that is called SHOP. That stands for Small Business Healthcare Options Program. And what that is it is like the marketplace, but it's for small businesses. Any business in the state of Ohio less than 50 employees or less than 100 in some different states and other rare cases, you can actually use the marketplace to help provide insurance for your employees. And we know there's a lot of entrepreneurs out there and small business people that say, look, I value my employees. I want to keep my good talent, but I just don't think I can afford to offer it as much as I might like to. The government will offer tax credits that are slightly different from the ones we've been talking about here, but they are still a tax credit, and those are used to help those small businesses afford to provide insurance for their employees, and that can even extend to their employees' families. It's like any other insurance plan that you might shop around for as a small business, except that the new law has made it possible through the marketplace to do it in a way more affordable way than a lot of small business owners ever thought was possible. And that is something that we are happy to do. I've helped numerous small businesses and even nonprofit organizations. I want to throw that out there too, that you do not have to be a for-profit entity to do this. If you're incorporated as a 501c3, we can help you with that. And like any family or individual, if you aren't sure whether or not it can work, just call us. It costs nothing to meet with us. It costs nothing to sit down and do a consultation. We want to make you aware of what you might be eligible for, and then it's up to you ultimately to make that decision, but we just want to make sure you have all the information. So in a nutshell, just give us a call and see what you might be eligible for.
I just want to say that we're excited about the work that we do and the services that we bring to the communities that we service and the people that do outreach with us. If it wasn't for them, sometimes we would not be able to meet the people that we need to meet to assist them to make decisions that are best for them and their families. So I am grateful, privileged, honored for being here today and also being able to do something that I really believe in.
All right, so before we end it, tell them how to reach you again.
Definitely. So you can reach us at our Dayton office, but we'll happily come down to you. It's at 937-222-7270, and just ask for one of the navigators. There's 4 of us that'll be happy to help you. And then you can also go to our website, helpmeenroll.org, or you can email us at rfay@weareresolute.com, or Marjorie at MMOSELEY@weareresolute.com, and we'll be happy to set up a time to meet with you at a time and location that's convenient for you and your family, or you and your small business, whoever it might be.
All right, well, listen, thank you again for taking time out. I hope that you've gotten some information that will definitely help you in making your decisions on getting health care. If you have not enrolled, I can't say this enough, but I'll keep saying it until everybody in this country is enrolled, or at least in this area that can see the show. So get enrolled, get your health care. It's better to be healthy. Listen, sickness is going to come probably for somebody that's watching. Sooner or later, it'll be better to have it covered. There was an old, I think it was Joe Tex, that was a singer that had a song that it's better to have and don't need than to need and don't have. Listen, I'm your host, Pastor Jackie Jackson. I want to thank you again. We want to thank our producer, Anita Alexander.